We have speaking with us today, Dr. LaTasha Fraser, Charles Vannoy, and Dr. Lynn Holden. Dr. Fraser is the Senior Program Coordinator for Science and Technology Entry Program, or STEP program, in the Office of Diversity Affairs at NYU Grossman School of Medicine. She is a molecular geneticist scientist. She received her undergraduate degree from the University of New Haven, her master's from the University of Connecticut, and her PhD from Rutgers University. She is dedicated to mentoring, teaching, and recruiting prospective students into the STEM field. Mr. Vannoy is the Vice President of Patient Care Services and Chief Nursing Officer at the Valley Hospital. He received his undergraduate degree in nursing from Fairleigh Dickinson University, his Master's of Business Administration from Capella University, and his Doctorate of Nursing Practice from Rutgers University. He co-chairs Valley Social Equality Council and was last week named Bergen County's Unsung Black Hero in Healthcare. Unsung Black Healthcare Hero. I messed it up. Dr. Lynn Holden, who will be joining us momentarily, is a professor of emergency medicine at Albert Einstein College of Medicine. She's the vice chair of diversity and inclusion in the Department of Medicine at Albert Einstein College of Medicine. She's the president of Mentoring in Medicine Incorporated. She attended Howard University and Temple University School of Medicine. She co-founded Mentoring in Medicine, which is a science and health youth development nonprofit that inspires, educates, and empowers low-income students. I'd like to welcome all of our panelists. And I think we'll start in order of how we did the presentation. Dr. Fraser, Dr. Vannoy, and then Dr. Holden. Again, thank you all. Dr. Fraser?
Awesome. Thank you so much, Dr. Bridges, for that awesome introduction. And I'm really super excited to be speaking to you all today. So I will just take one moment to share my screen. Awesome. Can I get a thumbs up if we can see my screen? Awesome. Okay. So again, thank you so much for the organizers for taking the time out to invite me to this awesome talk. So like was stated, my name is Dr. LaTasha Fraser, and I am the director for our Science, Technology, and Entry program at the NYU Grossman School of Medicine. And so today, what I am really excited to talk to you all about is the importance of pipeline programs for our underrepresented minorities. So what exactly is a pipeline program? So by definition, a pipeline program is essentially designed in order to make sure that we're providing the resources necessary, whether that be educational and or career support to students that belong to historically underrepresented groups, such as our African Americans, Hispanic Americans, et cetera. And essentially the reason why these pipelines are important is because many times the individuals in these groups are facing different challenges when they're trying to apply to different healthcare professional programs. So here I have just an illustration of a pipe, which we will consider as our pipeline program. And we have little Dr. Fraser kind of being a baby and going through the pipeline program. And so by years in magic, we'll have Dr. Fraser turn out to be current adult Dr. Fraser, right? Who has a PhD in molecular genetics. But the thing with this is that although pipeline programs are really super important for making sure that we are getting higher percentages of minorities in these healthcare professions, it's actually not completely the reality that we see today, right? So here is some data that was taken from 2018. And so what you can see is of the physicians that are in all of the United States of America, right? Only 5% of these physicians self-identify as Black or African American, and 5.8% for those that identify as Hispanics. So looking at this data, what we have to do is essentially take a step back and kind of dig a little bit deeper into why we see this sort of discrepancy. And so when we dig a little bit deeper, what we see is that even though we have these awesome pipelines, right, you can see that we have a higher percentage of underrepresented minorities that are graduating with bachelor's and master's degrees, but there's a significant drop off in all of these different educational categories that focus in STEM. When we're talking about people getting into doctoral programs, PhD programs, MD, DO programs, all of these programs, there seems to be sort of a drop off in that sense. And so why do we see that? The reason why we see that is because of something called the leaky pipeline, right? So ideally, you want to, as I had depicted before, take babies and throw them into the pipeline, and then years later, they come out on the other end as whatever it is that they want to be in the medical field. But in actuality, there are actually cracks in the pipe, and there are things that you have to jump over, challenges that people need to overcome, which kind of like cross the gamut of maybe there's family issues, or maybe there's just resource issues. And because of that, we start losing people throughout that pipeline. So although we want a higher percentage of individuals that are minorities coming through the other end, we don't have the output that we would like. And so for me, that kind of brings me into my story about how I got to where I am and where it all began. So I am a New Jersey native, so born and raised. I'm from Paterson, New Jersey. And for those of you that are familiar with Paterson, New Jersey, you're probably familiar with the fact that it is an inner city. And so the household income from that inner city is on the lower end of the spectrum. And then if you take that coupled with like the education that we are getting from the inner city school system and compare that to more affluent neighborhoods, sometimes you can see that there are definitely some gaps there that need to be addressed. And so for me, being a child of Paterson, New Jersey, I really have to attribute most of my success to my parents, right? Because I always say that the most important thing to becoming a professional in STEM is your exposure, right? If you're not exposed, or if you don't see that representation, then there's going to be, you're probably not going to think to even get into the field. And so when I was in the 7th grade, my parents actually enrolled me into a STEM program at the New Jersey Institute of Technology, NJIT. And it was here that I absolutely fell in love with science. I did one forensic science experiment and lifted one fingerprint off of a glass. And I was like, yep, I could do this for the rest of my life. I'm pretty content. And so from there, I made the decision in my mind, all right, I can be a scientist. And the cool thing about it is that, what you probably aren't noticing in this newspaper article that I'm in, many of my classmates look like me, right? Many of my teachers look like me. So it wasn't like, oh, this is something that's so unattainable. I was like, oh, I can see myself in these individuals. So, hey, I can definitely be a scientist. And so that's when I began to chase that. But again, I need to reiterate, especially for the parents that are in on the call, exposure is key. You have to be your child's biggest advocate, because being in the 7th grade, I didn't really understand how to advocate for myself, right? So moving forward, I graduated first right across the street from BCC at Paramus Catholic High School. And then I applied to and was enrolled into the University of New Haven, where I double majored in forensic science and biology and had a minor in chemistry. So that sounds like a lot, right? But I really want to emphasize the importance of your resources and the importance of your network, because I love to I always say I sit in my truth. And with all of those, degrees and minors that I have, that was one extra class from my required classes from forensic science, right? And the reason why I knew that is because of the resources and because of the friends and the network that I had while I was on campus of people that went through the process already, that pulled me aside and said, hey, Tosh, just take this extra class and you can get all of these extra majors or all of these extra degrees, right? So I was like, all right, awesome, I'm gonna do that. But even though you have these networks, you want to make sure that you're utilizing them in the right way. So one aspect that is like kind of in the forefront of my mind is when I went to my guidance counselor and I said, hey, should I do a summer of research, or should I do an internship before I graduate? So she mentioned, yeah, you should probably do an internship. You can go home, still have a good summer, and then come back and, finish what you have to do and graduate. So I was like, all right, cool, I can do that. But actually, you have to be very strategic with the mentors that you have, because the question I should have asked, right? The question I should have asked was, I want to be in this field. what choice should I make that would be the most beneficial for me, right? And if I had asked the question in that way, I think I would have saved about 3 to 4 years of schooling in the future. But I did my internship anyway. And I, at the end of the internship, became aware of the fact that to work at a crime lab in the state of New Jersey, you need to have a master's. So I got my master's from the University of Connecticut, but while I was getting my master's from the University of Connecticut, I really started to understand what it is to overcome challenges. I really started to see what the leaky pipeline actually is. And the reason why I say that is because while I was shipped off to Northern Connecticut, in many of my classes, I was the only female. So I was doing what we call NMR, so nuclear magnetic resonance, which is, for all of the healthcare professionals in the room, that's basically an MRI for proteins, right? So I was the only female in those classes. And then also in the entire graduate school for molecular biology, I was one of 2 Black students, right? And so immediately, when I'm trying to push through my classes, immediately I start thinking of things that are like imposter syndrome, right? Am I good enough? My grades aren't that great, although they were, but my grades aren't that great. I'm not measuring up. And then there's the burden of feeling like, since I'm one of very few, I feel like the burden of me being the representation of my entire race, right? Which is a lot to hold in addition to getting through a master's program. And so with that being said, I was presented with the opportunity to become a PhD student at UConn, and I had to make a decision for myself. And I think a lot of us are going to be making this decision throughout our lives. And one of them is that you have to make a conscious effort to find the resources that you need to be able to thrive, right, in your environment. And you can't be afraid to change your path in the middle of your path, right? So I essentially then enrolled myself into Rutgers University, where I basically had just restart my PhD path, right? Whereas I could have had a little bit of an easier time at UConn, but just didn't feel like I had the resources and the support that I personally needed as an African-American woman in a graduate school program. So at Rutgers University, I learned a couple of things, which I pointed out here. One, to be unapologetically myself. If you guys haven't picked it up yet, I'm a little bit chatty, and I do like to have fun, and I'm a little bit goofy from time to time. And I distinctly remember walking into a class and somebody saying, you should probably boil that down a little bit, because when you go looking for jobs as a scientist, that's not really what the mold of what they're looking for. And I completely went against the grain with that. And this picture in the middle kind of exemplifies that. You are whatever it is that you want to be, right? And you are the mold. And if you don't fit in the mold, break the mold, right? And stay true to who you are. Also, you've made it to where you are not by luck. Some might tell you that it's luck, but you've made it by your own work ethic, which I have represented here, and give yourself some credit, right? Make sure you have the friends, which is one of my best friends from graduate school here, that can support you, and then also paying it forward. So in the last few slides that I have, I will kind of advance into what I do now. So I graduated with my PhD, focusing in molecular genetics, and worked as a scientist for a few, but then started to realize which aspects I had the most fun when I was in graduate school. And honestly, it was when I went to these conferences called Abercans. And it's essentially a research conference where minority students are able to come in, undergraduate students come in and talk about how they will move forward with a doctoral program, and essentially exposing children to the path that they are supposed to take. And so with that, then I am now directing this program, Science and Technology Entry Program at the NYU Grossman School of Medicine, where I'm doing exactly that and having the greatest time of my life. So in my last slide, what I will tell you all is one very key fact that I don't think many minority students know. But if you are interested in a doctoral program, one thing that I didn't know until I got to UConn was that PhD programs in America and also internationally, for those of us that like to travel, are fully funded. And in America, fully funded by the government, right? And this is for not only Ivy League institutions, this is for public institutions. So like I went to Rutgers University and some private institutions as well. They're widely available. Every single student is free. It's not a scholarship for some, it's a standard for all, right? Every student gets free tuition and also a stipend that's included with that tuition. So essentially you're getting paid to go to school and get a doctorate and learn. The only thing that the student covers are just the cost of living. And so with that, I have my email listed at the bottom of this slide. So if you have any questions, please feel free to send me an email. I'm glad to talk to you about my path and maybe give you some advice on where I'm going. And I know that we're having a question and answer period towards the end. So I would gladly like to answer those questions as well. And thank you for your time.
Thank you very much, Dr. Fraser. Dr. Vannoy?
Yes, thank you. I'm just going to take a second to switch over to my PowerPoint, which is not as nice as LaTasha's PowerPoint, and I knew that was going to happen. There's no way I could squeeze a baby into a pipe and have a full grown-up come out the other side. It would take me hours. So let's see. Just give me a thumbs up if you could see my presentation. All right, good. All right, so thanks again, very great presentation by LaTasha. We share a lot of the same experiences. Some things a little bit different, but I'm going to basically talk to you about Valley Hospital, where I work. I'm going to talk to you about my career and how I progressed through the organization. I'm also going to go into the importance of having people of color in roles, and specifically, I'm going to focus a lot on healthcare because, again, that's where I am, and I definitely see the need. In your slide where you showed only 5% of physicians in the United States are African American, we are about 12% of the population. So it's really hard to have care that's equitable when you have that type of imbalance. So again, I'm Charles Vannoy. I'm the Vice President of Patient Care Services, and I'm also the Chief Nursing Officer here at the Valley Hospital. I'm also co-chair of the Social Equality Council. One thing I just wanted to talk about with the group is about my career here at Valley. And when I talk about my career, if anybody told me in high school that I would become a nurse one day, I'd like, you're crazy. Like men are not nurses, first of all, back then. And if you ever even dared to tell me that I would be the CNO at Valley Hospital, I would say you're crazy, because that person, that CNO, whenever I saw the CNO when I was a nurse, was always that larger than life person that you're like, oh my gosh, the CNO is here, and what am I going to say to her? And never wanted to embarrass yourself. But I am definitely a product of some luck. I know LaTasha says it's not luck, but I think that I'm definitely a product of some luck, a lot of hard work. But I fell into the right organization. I fell into the right career by chance. But let me get started with how my life progressed. And yesterday I was putting this presentation together, and I said, oh, let me do it like a book, and I'll have like different chapters in the book. And I'll like chapter 1's like the early years, chapter 2 is like the Mr. Big Shot, and I'll just go down through my life and it kind of makes sense. I don't know if my life's worthy of a book, but we're going to give it a shot. So when I talk about my early years, unlike LaTasha, who was smart enough to know what she wanted to do early in life, I was exposed very early to healthcare. My mother was a physician. She was a pediatrician, and she always talked about, she had 3 sons, and she's like, I have to get one physician out of the 3 of you guys. And she didn't get one. And none of us were even interested at all in going down that road. And, I was a decent student. My grades were, probably middle of the road at best. Didn't really value education, but knew I had to work hard to do whatever I wanted to do in life. So I got through high school, went to college. And I remember meeting with my advisor and she said, what do you want to do when you grow up? And I was like, I don't really know. I'm just interested in how am I going to get out of college quickly. And she said, either you can do liberal arts or you can do business. And I was like, my mother would never go for liberal arts. So I'm like, what? I'm officially a business major. So I went to school for business. And, while I was working in school, I was also working part-time at an electronics store. And, throughout my career, I've always gravitated to taking jobs that had more responsibility. So if I was in a company, I'd always want to move up in a company. So as I was going to school, I was also working at this electronics store, and I started out as a stock person. I'd bring the boxes out to the people's cars, put them into the cars. And, throughout my time there, you meet certain people, and if you run into the right people, I've run into several people in my life who just, they've said things to me that motivated me, that made me believe in myself. And I remember I was talking to one of the salesmen, and he said, Charles, he said, you're the kind of person that no matter what you do, you're going to be successful at it. So don't be afraid to do anything. And, he spoke to the manager and he said, Charles would be a great salesperson. So the manager made me a salesperson, and, I was pretty good at that. And next thing I know, I was the assistant manager of the store. And then I was the manager of the store at probably around the age of 19. And that's when I became chapter 2. That's when I became Mr. Big Shot, because I thought I was like so cool. I was like still living at home, obviously. And I was making like good money for living at home, right? I was driving fancy cars. I was going on nice vacations, just totally wasting all my money. And my mother always told me, no matter how much money I made, she's like, you know what? You need to have a career. You need to have a profession. You need to save money for a rainy day. And I'm like, oh, Ma, like any kid, what do your parents know, right? Oh, Ma, it doesn't rain where I live. I'm going to be fine. I'm going to be fine. And I worked in that job for a couple of years. And then one day I come to work and I go to the door to unlock it, and I see a chain on the door. I'm like, oh, that's unusual. Why is there a chain on the door? Well, that's because my job went out of business. And, so that was a big point in my life, a big point of change. And that takes us to chapter 3, digging out of the hole. And I call this chapter Digging Out of the Hole because I was literally 2 weeks later digging a hole in some person's backyard saying, what happened with my life and what am I going to do? And, that was really a changing point in my life. And I was like, what do I want to do? And, at that point in my life, I had just broken up with a nurse who I was always really jealous of because she worked a lot less than I did. And she made more money than I did. She was working like 3 days a week. I was working like 5. So I didn't think that was fair. But I also said to her one day, I was like, I wonder if I could be a nurse. And she said, you'd be a terrible nurse. And she gave me 10 million reasons why I would be a terrible nurse. And who knows if she was right or not. But I decided to go back to nursing school because it was, I always thought that I naturally cared about people. And that takes us to the next chapter. Like, do you care enough? If you go into healthcare, I would tell anybody, if you go into healthcare, you have to make sure you care about people. Do you care about the person sitting next to you, whether they're red, white, black, brown, or blue? Do you care about people's health? Do you want to do good things for your peers and for society? So if you say yes to that, I would encourage you to get into healthcare. We need more nurses. We need more respiratory therapists. We need more people in radiation. We need more techs, OR techs. We need people of various different races, colors, and creeds in healthcare because we want to be more representative of the population. And that takes us to the next chapter. It's not easy. And LaTasha talked about that. There were times when I made this great career change when it wasn't easy. There were times in school where I really didn't feel welcome. I think people question, like, do you really want to be here? Is this really what you want to do as a man, as an African-American man? Do you really want to be a nurse? And you really have to push through those things and you can't doubt yourself. And I got through school and then I was like, well, where do I want to work? And this is where the dumb luck comes in because I was like, oh, I want to work at an inner city hospital. And at that time, they weren't really hiring like brand new nurses. So I ran across Valley Hospital. I'm like, okay, I'll apply there. And like you do these little things in life, you never know, how these decisions are going to impact you. So I end up working at Valley Hospital. And this place, from the first day I came here, it's always been very welcoming. It's one of those places you never felt like you were imposing on anyone. You were able to ask questions. My managers were always very supportive. My mentors were always very supportive. And again, this is not like I did research or where do you want to work? And then sometimes it's, again, I just call it dumb luck. So the next chapter is do they care enough? Does your organization care enough about you as an employee? And one thing I think it's very important to know is that your organization will care for you if they see that you care for the organization. You come to work, you do a great job. Like, what do you bring to the table? You know, they're going to care if when you're not there, they notice the difference. Oh, Charles is not here today. So you really have to put the work in. And, you know, I think it's reciprocal. If you care enough, your organization is going to care about you. As I moved through the organization, and again, just like in my previous job, I wanted to take on more responsibility. So I was a nurse for a couple of years. I became a supervisor. I became a manager. I became a director. This is over the course of time. As I was doing that, I was also furthering my education as well too, which I'm going to go into. But as I grew in the organization, and again, this is just for people who want to go down the leadership track, is you need to surround yourself with great people. And that's where the "you're surrounded" comes from. I'm blessed to have one of the greatest leadership teams that anyone could really ask for. And I don't feel any insecurity, like knowing that a lot of these people are really smarter than me. None of them are on this call now, so I don't have to know that. But I know that I'm not the smartest person sitting at the table. I'm the person who gets the group together. I'm the person who gets the group organized. But I'm also somebody that's very open to taking feedback from people, and I support my leaders. And again, if anybody wants to be a great leader, don't ever feel like you have to be the smartest person at the table, or you have to have a tight grip control over your leadership team. You need to let your people grow. And when they're successful, it shows others that you're a great leader. I find that some leaders are afraid to let their people shine, and you can't be a great leader if you're not going to let your people shine. So that's the "you're surrounded" part. And again, education. You know, again, I've been part of this great organization that allowed me to go back to get my master's degree, allowed me to go back and get my doctoral degree, and helped considerably in paying for the tuition for it. And again, I'm kind of in lockstep with what LaTasha said about pay it forward. And this pay it forward could be sprayed out throughout this whole list. Like, there's so many parts in your life, you should always be paying it forward. If you take a step, you should be looking back to see who's behind you and help that person, pull that person up the ladder, or help them climb a hurdle. And there's nothing more satisfying to me than to see people in this organization have grown through their efforts, but through some of my guidance that I was able to provide for them. So that's my story. That's my book that maybe I'll write one day. And I'll add some nice pictures like LaTasha did as well too. So next thing I'm going to get into is Black and Hispanic workers. Again, underrepresented in the workforce. And again, when you look at healthcare, Black people are 11% of the total employed population, and we're actually doing great in health related fields, which is good. A lot of that's in nursing and techs and diagnostic imaging, but you see in the other fields where we're definitely lacking: computer science and engineering. Also, Hispanics make up 17% of the employed population, but they're also only 8% in STEM careers, and then you look here across the board, they're about 8 or 9% in all these other careers. When you look at other ethnicities, you look at Asians, 6% of the employed population, but they're 13% of the STEM jobs. And you see in the different healthcare, in the different fields, the different percentages there, and their white counterparts, 63% of the total population, but 67% of STEM careers. So it just shows you there's a lot of imbalance there. Another reason, if you're not going to get into healthcare for all the altruistic reasons, if you're looking for job security and you're looking for job growth, over the course, the projected growth of all jobs in the United States is 3.7%. When you look at STEM positions, it's over 3 times as much at 9.2% growth moving forward from 2019 to 2029. And if you break that down specifically by different disciplines, in healthcare, it's 10%, computer work is 11%, you have engineering, physics, and life. And if you want to work in mathematics, which I would think would be very boring, that's why there's a 26% increase in mathematics. But if that's your thing, please go for it. I support you wholeheartedly. Another reason to go into a STEM career or healthcare is, again, all jobs, the median annual income is $50,900. For non-STEM positions is $46,900. And for STEM positions, the average median salary is $77,400. If you decide to go into a career like nursing, again, nursing is dear to my heart, the average starting salary is $85,000 a year. So again, that's pretty good coming out of college. The issue that we have here is when we look at the workforce and we look at salary by ethnicity, and you see there's a big disparity here across the board. Asian men make an average salary of $103,000, white men $90,000, Asian women $88,000, Hispanic men $73,000, Black men $69,000, white women $66,000, Black women $57,000, and Hispanic women $57,000. That's something that's a big problem, and that's something that we really need to address. And one of the ways we do that is we need more representation in the field of STEM. And more representation definitely gives us more power and gives us a position at the table to help correct this inequality which is existing. So not having representation in healthcare, it causes other issues. Minority patients have markedly worse healthcare outcomes compared to white patients. They're 2 to 3 times more likely to die from preventable heart disease and strokes. They also have higher rates of cancer, asthma, influenza, pneumonia, and diabetes. And we also deal with structural racism and unequal treatment. So one of the ways that we can work on this is building trust in healthcare. And we build trust in healthcare by people having someone of the same ethnicity as their provider. In many cases, again, this improves several outcomes. There have been several studies that show this, that it improves the time spent together with the patient. It improves medication adherence, shared decision-making, wait times, increased understanding of cancer risks, patient perception of treatment plan, and implicit bias. So again, we can see that outcomes will improve for the minority population if we have more providers and teams that care for us that look like us. And again, no quick fix. Again, my numbers pretty much add up with what LaTasha had in her presentation, where 56% of physicians are white, 17% are Asian, 6% are Hispanic, and 5% are Black. And when you look again at the percentage of the population, 12% of the population is Black, and I believe almost 17% of the population is Hispanic. So it's a big disconnect and definitely a lack of representation. When you look at the nursing workforce, there's still a big disparity. 69.1% of nurses are white, 3.9% are Asian, 8.6% are Hispanic, and 11.5% are white. So how do we have more representation when someone of color is seeking care? One way we can do it right now in the near future is to start looking at collaborative teams of physicians, APNs, and nurses that provide care for the patient. Because although we only have 5% of our physicians that are Black and 6% Hispanic, we do have 8.6% of the nurses Hispanic and 11.5% of the nurses are Black. So if you combine the efforts of nursing and physicians, you get teams that are definitely more diverse and more able to meet the needs of the diverse population. Now I just want to switch quickly to what we're doing here at Valley. Valley, what we did, and again, this is a direct response to the death of George Floyd. There were many organizations that were making statements about social equality at that time. I spoke to Audrey Myers, who's our president, and she actually reached out to me because she received a letter from an employee who was concerned about our stance on social equality. And she, as a great leader that she is, she wanted to do something meaningful. I mean, a lot of people were doing going out and getting down on one knee for, for X amount of minutes to represent the killing of George Floyd. But she wanted to do something that was long-term. She wanted to do something that was going to create lasting change at the hospital, which I think was great. So we launched the Social Equality Council in June or July of 2020. And we created the Social Equality Council around these 5 different pillars that you have here. Hopefully you can see them. We have 5 different subgroups that work out of this committee. We have a leadership engagement committee, and what this committee does, it provides educational offerings for our leaders. Like right now, every leader in the organization is going through what's called anti-racism training to talk about bias, social inequality, issues that are related to the workforce. And it's mandatory for every leader to attend that. After leaders go, other disciplines in the hospital, the supervisory team, and then frontline staff are all going to be mandated to attend that session. And we were a little nervous to start those types of sessions in the organization, but we've got nothing but positive feedback, and people were not aware of what they didn't know. And I think they're thankful in a lot of cases. Like, I didn't know that. I didn't know that word meant this, or I didn't know the history behind this or that. So I think it's really going to push our organization to the next level. We have the employee development work group that looks to create programs, mentoring programs for the community, employee development programs for employees that want to move up through the organization. Right now, we're developing a set of videos that will focus on different employees in the organization, particularly employees of color who've been able to advance in the organization, to show other employees that are just joining the organization that, yes, you can do it, you can grow in the organization. And we're also going to use it to try to attract a more diverse workforce. We have the patient and family experience team, which looks at the experience that our patients have within the hospital. We look at it by ethnicity to see if there's any difference between the experience that our Hispanic patients are having compared to our Black patients, compared to our white patients, and we try to adjust our care accordingly. We also have operational alignment, which looks at a lot of our hiring practices in the organization and our marketing practices. And based on a lot of work from this committee, we've changed the way we market our services to attract a more diverse population. And we also look at how we hire for different positions and where we seek out employees for the organization. So if you go to the same pool of people all the time, you're going to get the same people back. So when I was at one of the sessions that we had today for anti-racism training, one of the employees said that whenever we hired somebody for our department, we said, how can we hire somebody that was just like us? And then they wonder why they don't have any diversity in their department, because if you always look for somebody that's the same, that's what you're going to always get. So I think, and again, she didn't mean anything bad by it, but she was reacting because of what she learned about in the class. And I think a lot of people, they really come from a good place. And I think I work for an exceptional organization, but I think most people want to do good. Most people want to be respectful to their peers. Most people are open to diversity. And I just think a lot of the issues that we have in society today are related to people not understanding and not knowing about people that look different from them. Again, and the last pillar that we have that we work on is community partnerships. And this is where we look at how can we partner with local churches, local community centers, local towns to provide educational offerings. One of the biggest things we did, obviously, in the last year was promotion of vaccines, in the surrounding towns as well as in our organization. And we found, obviously, that we get better outcomes if you're going to a population that's mostly minorities. If we have physicians and nurses who are also representative of that population, if they go there, you get better outcomes, you get more adherence, you get better understanding. So that's where we stand right now. And thanks everyone for their time. And I'll take any questions at the end of the presentation. I know Dr. Holden was going to go next. And so I'll turn it over to her. Thank you.
Thank you so much, Dr. Vannoy and Dr. Fraser. I think you're going to hear quite a few overlapping concepts and themes in our presentations. My name is Dr. Lynn Holden. I'm a professor of emergency medicine at the Albert Einstein College of Medicine. Happy to be here to speak to you. And I'm just going to speak to you for a few minutes of future health and science professional, what I wish I would have known when I was going up through this path. because certainly I was the only one in my family who pursued this path. So I'm just going to share my screen briefly. Let's see. I can share screen, okay. Okay, Dr. Vannoy, I think your screen.
Am I, what am I?
Yes, we can flip out, thanks.
Let me see here.
Sure.
What am I supposed to do here?
It should be a green bar that's at the top of your screen.
Okay.
Yep.
A new share, hit new share.
It should be able to say stop share and like a little red.
I got it. Yeah, thank you.
No problem.
Showing my age there. Sorry about that.
No, that's okay. All right, very good. So again, just going to talk to you for a few minutes about my journey and give you some tips, which you've actually heard and I heard, thanks to Dr. Fraser and Dr. Vannoy. So I was born and raised in Philadelphia, the city of brotherly love and sisterly affection, known very much for its Liberty Bell. I, again, am the first one in my family to pursue medical degree. Certainly not the first one to graduate from high school or college, but the first one to go on with an interest in medicine. And that interest started when I was 6 years old. So I always knew I wanted to be a doctor. Watching television, I'm sort of dating myself, but there was a program, 2 programs I used to faithfully watch. Marcus Welby, MD. I wanted to be like Marcus Welby, and also Rescue 911. So between those 2 shows, those were my favorite TV shows. All the other kids were watching something different, but those were my shows, my go-to shows. So a little bit about my educational path. I left Philadelphia. I went to Howard University in Washington, DC. During that time, I actually went to an accelerated program. There are accelerated programs, 2 years of undergrad or getting a bachelor's in science, and then 4 years of medical school. However, after the second year, I discovered that I really didn't know so much about life in general. And you'll find that there has to be a balance between your academics, your emotional intelligence, we call it, your social intelligence. And coming out of high school, I really was very sheltered, honestly. I went to an all-girls Catholic high school. I was the only African-American in my class from 5th grade to 12th grade. And so Howard was sort of a flip. You know, there were lots of people that looked like me and there were like males. So it was like totally different. So I spent most of my first 2 years in the basement of Founders Hall in the library, and you know, sort of had a self-reckoning that, gosh, you know, I really need to get out there. I need to explore Howard. I need to explore, you know, Black history. I need to explore politics. And for the last 2 years, essentially, that's what I did. I did research. I was able to become involved in politics. I learned so much about Black history, art, etc. And really, while I was still studying, but I had completed the prerequisite courses. I want to take a break because even during that time period, I was really craving, you know, I needed to get more experience again in medicine through research, through community service, through working in clinical settings where there were patients. And I was able to do that during the summers. There's something that I'm sure we'll touch upon called pipeline. I like to call them pathway programs. But these are programs that exist during the summer, STEM programs across the country. And now that we're sort of hopefully, prayerfully turning the tide with this pandemic, hopefully they'll be up and running again. And that's when these programs basically will pay you to come there, to experience test prep, study strategies, to experience research, for example. So the programs I belong to were all across the country, and I actually didn't have to pay for any of them. They paid for me to get there. They paid my room, my board, and I got experience. During research, I remember I was in a program the summer of my junior year of college at Cornell University. And at the time, HIV and AIDS was really just starting. More was being known about it. And my PI, my the person I was doing research with, she basically had the brain of a famous actor, and she was dissecting the brain and looking at it under the microscope and trying to find out the effects of AIDS on the brain. So, you know, things like that, where I was up close. I got 2 publications from that just in 10 weeks. But those are the types of experiences that you can get outside of school, and you can bring those in to the classroom to help you and also your colleagues. And believe it or not, almost 30 years later, some of these folks who were in these summer programs, we still keep in touch. They are leaders and movers and shakers across the country when it comes to STEM, and we still work together. So it's important to take that leap. And especially if you're in high school, colleges love it when you actually spend a summer on a college campus, taking courses, experiencing a different scenario than being at home. After Howard University, I went on to Temple University School of Medicine. And then after I graduated, I decided that of all the specialties, I couldn't decide which one I liked. So that's where emergency medicine came in. And then I decided to do my residency in the Bronx, New York. I figured if I'm going to learn emergency medicine, I want to be in the place where I can just be immersed in all of the diseases and all the people that I'm going to need to know about for the rest of my life. And so my typical day as an emergency medicine physician, I go in, and this slide is blank on purpose because I have no idea. I don't know who I'm going to work with. I know there's going to be a team. Dr. Vannoy spoke about, the team that makes up the, that helps the patients. Yes, we have respiratory therapists. We have patient care technicians. We have EKG technicians. We have nurses. We have billers. So we have all these people working in the emergency department. We also are a teaching hospital. So we have physician's assistant students, medical students, residents, on and on. But the bottom line is, I don't know who's going to be there when I walk in that door. And I don't know what patients are going to come in and what's going to be wrong with those patients. So my job is really to be able to handle whatever comes through the door. So whether it be a gunshot wound to the chest, or if it's a lady who's delivering, or if it's someone having a bad asthma attack, or if it's someone whose finger was cut off at the deli because they weren't watching the machine, all of those things I have to know how to handle, because that's what I signed up for. So when Dr. Vannoy talks about caring for people, you have to, in this profession, really care for people. Those people who are, at their lowest low, those people who are in severe pain. I was telling my husband the other day, every shift I either get spit on, kicked, vomited, something. There's some sort of something happening, but you learn to appreciate how people express themselves, because oftentimes they just cannot talk. This is just a little bit about the activities that I'm part of today. I really try to be involved nationally with a lot of activities, especially when it comes to building the workforce. And so I started a nonprofit with a couple of friends called Mentoring in Medicine. And the goal is really to help students to become what they want to be, to help them dream, turn dreamers into health and science professionals. Dr. Vannoy showed a little bit about what is happening. This is with medical school, where you can see that, and this is reflected currently, between 1987 and 2005, only 5 to 6% of the students who sat in medical school seats, were accepted to medical school, were from the lowest quintile. That's the family income of $25,000 or less for the family income, annual family income. 48 to 57% of students, that's with the family income over $125,000, they were the ones that were sitting in medical school seats, mostly those who had the highest family income. So with Mentoring in Medicine, we really try to reach out to this population. We want to make sure that we are able to expose students starting in elementary school and help them through to career, to all the health careers that are available to them. We also try to reduce health disparities. How? Because we empower students to actually do that creatively. So we teach the students, they then create their projects under our guidance, and then they share that information. Dr. Vannoy mentioned that people Listen to people that look like them. They're more apt. Studies have shown that they are more likely to take medication, to come back to the doctor, to eat certain foods that are recommended by someone who is from their culture. And so we teach students, even in elementary school, how they can save lives. All right, so here are my 3 keys to success. And this is what I want everyone to understand, that it's hard. It can be a hard path becoming a health or science professional, whatever health or science career you want to go into. But I think if you have these 3 underlying keys, these strategies, that you certainly, the path will be a lot easier. The first one is passion. Okay, you have to have the passion to want to do this. You, not your grandmother, not your mother, you have to be the one that wants to embark on this journey. And certainly it can be a journey, and it could be a journey with twists and turns. You may not, pass the test. You may have to take it a second or third time. There are ups and downs, hills and valleys, but certainly if you're passionate, you will persevere. And so passion is key. You have to want to do this. All of our students make passion boards. What does that mean? That means that they sit down and they just make a collage, a virtual collage of what it is they're interested in. What are they passionate about? Do they want to be a nurse? Do they want to be a doctor? Do they want to be a respiratory therapist? Do they like gardening? Do they want to travel? What is it that they're passionate about? And having that passion board actually will help you to define and continue to keep your eye on that prize. The second thing is practice, and that's really important. It's important that if this is something you want to do, that you're practicing it. So I explained how I use my summers to get extra experience. Well, certainly, if you're interested in, for example, veterinarian medicine, then you would try to get experience in a veterinarian hospital. If you're interested in research, you would try to get experience in a lab or outside the lab in the community. And it's very interesting because it's not easy to get these opportunities, especially now during COVID. However, they do exist. And so you have to go above and beyond to get them, but they do exist. And certainly, if you're able to demonstrate that even during COVID, you were able to take advantage of opportunities, that says a lot on your application. And finally, people. Dr. Fraser mentioned the people in her life that helped her along this journey, as did Dr. Vannoy. And I just want to say that when you talk about people, there are a couple of different levels. First, they're, your supporters, right? The people that belong to your church. There are people who, your hairdresser. There are people, your family members. So they all encourage you through their words, through their actions, over the course of years, once they know what it is you would like to become. Then you have, role models, people you look up to. I want to be like, I mentioned earlier, Marcus Welby was someone that I wanted to be like Marcus Welby because he saved people. They were happy. He loved them. They loved him. It was a la 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 sort of society, which of course doesn't exist, but to a 6-year-old, that's great. And then you have mentors. These are people who will take you under their wing. They'll help you. They are people who are more or less in your specialty or have been through the journey that you're going through. I can say well over 40 mentors, people who along the journey have said, you know what, I'm going to help you do this or watch me do that. And, it wasn't like I said, hello, I want you to be my mentor. It was by service. And Dr. Vannoy mentioned that he used to carry boxes. It's the person that sees that you want to serve, that you want to help, who will say, you know what, I like your attitude. I want to help you out too. So just remember, when you're looking for a mentor, who can you serve? Who's that person? How can you help that person so they can in turn help you? And finally, there's sponsors. And these are people who, whether you know it or not, are going to talk positively about you, advocate for you behind closed doors. Pick up that phone and say, you know what, that guy, Charles, he is special and I want you to give him an interview. So these are people that we need to have and need to gain. And it's only through experience that you do that and through service. I like to say all of our students have a personal advisory board that have various levels, the supporters, the role models, the mentors, and the sponsors that help them to get to where they want to be. So if you have any questions, certainly contact me, and you can join us at Mentoring in Medicine. And I'm going to stop sharing and can't wait to answer some of the questions. So thank you.
This was simply fabulous. I'm here behind the scenes feeling quite impassioned and moved and invigorated. I see some questions coming through. So first I wanted to thank all of our attendees for being here, and thank you for the questions that I see coming. And I definitely have to thank this panel. So much of what you said overlapped, and there was not a plan. We didn't share each other's slides to kind of know, but it's like as you each passed the baton, you touched on so many things that I think really resonated, hopefully with the audience as well as it did, with me over here in my little cubicle. So one question that came through had to do with outreach. And so the question essentially is, do you have any opinions on what more we can do to reach out to underrepresented folks in the community in the tri-state area to get them to be a bit more aware about some of these opportunities for work in the health sciences?
Yeah, so I can take a quick stab at that. So that's actually something that I'm actively doing in the program that I am running for the Science and Technology Entry Program. So the biggest thing is to ensure that you are going to every single, basically looking under every rock to make sure that you can gather as many people as you can, right? So specifically for us, what is kind of like the standard, right? Getting in touch with schools, elementary schools, high schools, et cetera, and kind of like promoting, whatever, for me, promoting what our program is. But you kind of have to think outside of the box. So for instance, we are putting flyers in, pediatric offices, because we know that that's a location where parents and, their children are coming and would be, available with the eyes to look at these flyers. Also, I know that it was mentioned throughout the panel discussion that we had, but going to local churches, right, where you have not only the kids, but you also have parents, maybe grandparents, and someone that can spread the word. So I think it's a matter of thinking outside of the box and trying to make sure that you are servicing all areas where kids might frequent.
Anyone else?
Yeah, I'll just add to that. I think, Valley is trying to make a concerted effort to kind of get out to the community more. And I think you talk about reaching out, looking outside the box. Like, we need to look outside of our immediate catchment area. Like, we serve a certain community. There's not a lot of diversity in that community, but there's other communities out there that are in need of mentors and of role models. And I think it's such a great point that we really need to look in different spots, look in different places where we can actually make an impact. So that's what we're trying to do.
Yeah, so I ditto everything that Dr. Fraser and Dr. Vannoy said. Schools definitely, because we do work in schools, but it's interesting because we're people that we spread things by word of mouth. So we certainly have advertised in barbershops and beauty parlors and churches, of course, but places where where we know people will be. And certainly it's the mother that tells the neighbor and the auntie that's at the hairdresser. So there are really many different venues that we can meet people where they are. And the second way is radio. A lot of our students listen to radio. And so we try to advertise our larger events on the radio so that we can bring in families, not only students, but their parents. And of course, on social media. So social media is big. So I meet them on social media too.
An interesting sort of flip to the question about what more can we do. Someone asked, or I'm gonna paraphrase, I can relate to your experiences associated with taking on the burdens of being the representation for your ethnic race. I live in an area with few minorities, and I've established a diversity committee in my town, but I am meeting resistance. So for each panelist member, how do you overcome resistance while not burning out?
You know, I'll start. I think you have to be persistent, but you also have to be patient, because that resistance that you're experiencing has happened over decades. And it's not like you're going to start this diversity committee and flip people immediately. I think it's like dripping water. You got to do it little by little. If you could change people's minds a little, you know, a little at a time, I think you have to be realistic with how fast change can happen.
Yeah, I echo that, Dr. Vannoy. I think also that, you know, you have to meet people where they are, and take them to where you want them to be. There's a great book called How to Win Friends and Influence People by Dale Carnegie. It's a book that all of our students read, and it's a way to really, you know, find out what makes people tick, and then try to meet them where they are. And just understand that, you know, some people just aren't going to budge. They're not going to endorse whatever you're doing. But there are plenty of people that will. So you have to discern, you know, which people will be your allies and which people will not be your allies. And make sure that, of course, they don't know how you treat both of them the same, because you never know. But, you know, you really want to make sure that, you know, that you listen to them. And I think people will value you and your efforts more if you listen to their side and have a mutual discussion about it. But How to Win Friends and Influence People by Dale Carnegie is a very helpful book.
There's a question related to college and college experience. So one had to do with attending a historically Black college, and then what shaped your decision to attend or not to attend. And then for those who did not, how do you create your network if you're going to a college that's primarily a white institution?
So for me, I attended a predominantly white institution for definitely the University of New Haven, the University of Connecticut, and like I said, you have to kind of be your own advocate in these sort of spaces. So for instance, when I was at Rutgers University, I created the Minority Student Association, where we kind of sought to make sure that we're supporting students, not only academically, but also like socially, and also making sure that we had networks put in place so that the minority students that were at Rutgers were able to kind of go off and be fruitful, right? And to also make sure that all of the resources that are available are kind of like right in their face. And I think that that's something that's extremely important, because one thing that I've learned, and Dr. Holden, I don't know if you can attest to this, but I think that I've learned that going to an HBCU, there are definitely programs that I didn't know even existed, right? Because they weren't necessarily advertised in the spaces that I was at. And so to answer that, then I needed to create that space for myself, which is extremely important.
And I think another way, and I think I alluded to this when I presented, is if you're trying to establish a network and trying to get people to support you, I think you have to show them what value you bring to the table. Like, you know, you have to get people, if you want to grow, you want to be successful, you have to get people to care about your growth. I think that's one of the key things. If someone sees you as somebody who is going to put the work in, somebody who's nice. I mean, I think one of the biggest things somebody told me is, if you want to be successful, be nice to people. Like if you're working in customer service, smile when you talk to people, be engaging. If people don't see that, like I always look for opportunities to mentor people and to grow people. And I think it's natural as a human being. Like if you see somebody who looks engaging, somebody who looks interesting, who smiles, that's the type of person that you say, oh, I see potential in that person. Let's see what they're all about. So I think that's part of it, you know, just being a nice person and a good person, I think, regardless of what your race or color is.
Yeah, so again, I did go to Howard, and it was very interesting because I distinctly remember getting the acceptance letter from Howard, full scholarship, and also the same day the acceptance letter from Harvard, and having my father say, well, of course you're going to Harvard. And I said, well, let me think about it. And so ended up at Howard. And I can truly say HBCU, I wouldn't trade it for the world. I mean, I had a wonderful experience there. Like I said, I grew so much, especially coming from, the background that I had been in middle school and high school. But, it's not the real world. And so, we have some students who are at Howard for a very long time, taking lots and lots of courses and getting lots of degrees because, in essence, they don't want to leave. It's wonderful. It's like utopia there. But, you have to realize that that's not the real world, not the real workplace. And so when I went to Temple, I agree with Dr. Fraser, you have to sort of create those spaces. Yes, as Dr. Vannoy said, you want to be a nice person, you want to be approachable, and I'll circle you back to how to win friends and influence people, because that was so very helpful. But you also want to create that space where you can have, quote unquote, your posse, your team, who you can rely on. And I did that through the Student National Medical Association, aligning myself with that organization while I was in medical school. But certainly there are many organizations, even at predominantly white institutions, that exist. MAPS, for example, the minority, I'm not quite sure of it, but it's aligned with Student National Medical Association. Dr. Burgess may actually know the name of it, but there are programs out there. So search for those. And now with COVID, there have been virtual programs cropping up. So certainly there are many programs that can help you with whatever career that you're interested in.
I'm seeing one more question. So if anybody has any additional questions, please put it in the chat. But there was a question that came up. What STEM careers are hot now to pursue? I know what I do in terms of the practice of maternal fetal medicine. We talk a lot about genetics. So I'm going to throw this first one to Dr. Fraser and then ask Dr. Holden and Dr. Vannoy if they can then add into.
Yeah, I think that right now, probably the hottest field to get into is definitely immunology. And I know that, as I mentioned, so it's great because, if you want to get into a doctoral program, largely it's pretty much free if you're trying to go somewhere in America, which is awesome. And I think that immunology and learning about, vaccines and the history of vaccines. And, I can't remember what her name is. I know that she had worked diligently with the COVID vaccine. And when I met her, she said, I just wanted to create a vaccine for the common cold, which is, something that is like, I never even thought about that. And that is super, super awesome. And I definitely think that kind of being in this world of like the pandemic and getting through other epidemics that we've been through in the past, immunology is something that will always be useful, because I think, in the future and down the line, there's always going to need to be, that brain power in figuring out, antibodies and vaccines and things like that. So I think that would probably be the hottest topic for this time of year.
So of course I'm going to say nursing, of course, because I'm a nurse. So of course nursing is there's obviously a demand for nurses, and there's a demand now. The population is aging, people are living longer. We've had a lot of people left the workforce in the last couple of years because of the pandemic. I mean, it's just been, tough work. And there's so many things you could do in nursing, though. You could be a bedside nurse. You could work for an insurance company. There's so many different things you can do. It's just one of those careers that gives you so much flexibility. You can go into leadership like I did. You can be a clinician at the bedside. You could become an APN where you're almost an independent practitioner in a lot of ways. And a lot of people are heading in that direction now in nursing too, which is more of a recent trend. But yeah, I'd say anything in healthcare, there's definitely going to be a demand for.
Yeah, I would say when it comes to STEM, I think technology, especially, all of the hospitals are now getting their electronic medical records. So that's something, and with the pandemic, telemedicine has become, a new, it's not new, but it's more popular as a route for patients to access their physicians. From the National Institutes of Health, which is, everyone's heard about that because of Dr. Fauci, I'm sure, but that their main mandate now is really to teach data literacy to everyone. They want people to know about data science, and they want people to know about, how numbers relate to each other. And so that is certainly, that whole data science, they call it bioinformatics or health informatics, is certainly an up and coming area. As far as medicine is concerned, I guess, one of the things that drew me to emergency medicine is the fact that, emergency departments are always going to be around. No more have we seen it really since the pandemic, but, not only that, but we are open to all 24/7. So I don't know what insurance patient A, patient B, and patient C have, but I know that I will treat patient A, patient B, and patient C to the best of my ability. So for me, it circles back to, caring really. Yes, I work day shifts, night shifts, overnight shifts, evening shifts, and all of it is really to help patients. And patients know that the emergency department's open, and it's often called a safety net. Just because of that, a lot of patients can't get in to see their private doctors if they have a doctor. Patients may have insurance, they may be underinsured or not insured at all, but they know that they can go to an emergency department to get taken care of, whether it be for a somatic, a bodily complaint, a mental health issue, or even just a social issue, that they can get help. And so that's why I will plug emergency medicine.
A question just popped in, just wanting a little bit more information about obtaining a PhD and how that's funded and from an institute, from any institution.
Yeah, sure. So for me, what's very interesting is I tried to put in a slide that kind of gave an understanding of how many publicly funded universities have PhD programs that are completely funded, tuition free. And it was very difficult to find the information. So as I said, it's widely available, but I just don't think that there is that much effort put into informing people about this super amazing opportunity. And so essentially, I mean, you do need to make sure that you are doing the work on the back end to ensure that you can get into the PhD program. So as I said, if I did, prior research in a lab, then that definitely would have been helpful in my application if I wanted to, instead of taking a master's, jump right into a PhD program. That's something that would definitely be very helpful for you. But if you think about biomedical science and you're interested in doing traditional basic science as a researcher, honestly, what I did is think about the state that I wanted to be in. Typically, I was like, I love New Jersey, New York, and Connecticut, and just look up graduate schools. And then once you get a list of those graduate schools, you can just go and look on their web pages. And generally speaking, I would say about 85 to 90% of the time, they have fully funded programs. And this is something that is done through the NIH with the government, because we get a lot of grant money to do this research. And so labs are looking for some hands to come in and do research and submit publications. So you just got to do a little bit of legwork, but it is definitely there.
Thank you. So just in a quick summary, so we're here today partnering with Bergen Community College for their Black History Month program. Many of us would say that we live Black History Month every day, and we're a living history. When I think about where we are, where we have been, I thought recently of some of the service that we've been involved with and Martin Luther King. And two quotes of his that always seem to resonate with me is, of all the forms of inequality, injustice in health is the most shocking. And so I first heard that quote somewhere early in my medical career, and I was like, wow, with all the things that King was talking and doing and looking at, he noticed this disparity in health. And the other quote is when he says, the most urgent question is, what are you doing for others? I thank you all for taking your time to, to be here for us to look and seek and talk to all the others and to tell them about what we do. And what I heard from everybody, because you all kind of said so many things in the same way, but what resonated is be engaging and be nice. Find and explore your passion and, make sure that we pay it forward. So I'm going to ask our wonderful panelists if they have any last, parting words. I think you've left us with so much knowledge and just like, in this Olympic spirit, all this flaming passion to go out and create lasting change. I'm ready, maybe not today, but to get back to the office and see some patients with a big old smile on my face behind my mask, because we're still masked. But I usually have a smile on my face anyway. But again, thank you. Any last parting words before we say good luck to all the future healthcare professionals that are on this call and the people that love them?
I think for me, being your own advocate. I think that all of us, we are human, you will be hit with setbacks, but specifically being a part of underrepresented minority group, sometimes we can even feel like we can anticipate what those setbacks are going to be, but just charging through that and understanding that you are capable of getting that goal, and you are capable of doing whatever it is that you want to do. Just make sure that you surround yourself with the resources that you need to make sure that that happens.
Thank you, Dr. Vannoy.
I would just say be courageous. It's a tough journey, but you have to want to follow through. It's not easy. You could easily talk yourself out of trying to take the hard path and take the easy path, but the easy path is the one everyone else takes. And we need you to be exceptional leaders in the future, because you're the ones that are going to guide the next generation.
And I would just like to say, don't be afraid to ask for help. People are here to help you. We're here, giving our time, because we know that if you want to do this, you can do it. But we are here also to help you. Certainly, if you have any questions about medical school, medicine in general, reach out to me. But that's why we're here, because we care about you, and we want to make sure that you realize your dreams and that your family can help you to do that.
Thank you all for those in attendance. This will be on the Valley Hospital website. The contact information as well for our wonderful panelists will be there. So we would like to thank you for taking your afternoon and sharing it with us. And again, congratulations, be well. Thank you.